think that doctors should go on strike? Nah, G, if a man like me breaks his leg and I have to be transported to an A&E waiting room, I'm looking at those shitty posters that say catch it, bin it, kill it for 2.5 hours of my goddamn time, and then the doctor has the audacity to go, oh, I'm not getting paid enough money. Realistically speaking, when you became a doctor, you signed an oath. In that oath, it entailed the fact that you will do whatever it takes in your power to maximise patient health and care. And man like my doctor goes, oh, I'm not getting paid enough money. I think it's hypocritical in the essence. Right. Well, that's a rather captivating way to look at things. This guy's working at McDonald's for the rest of his life. Do you think that doctors should ever go on strike? Right, so I'm a firm believer of the fact that this question requires a multifaceted approach that entails a wide variety of different perspectives. I'm going to focus on the arguments for doctors going on strike and the arguments against doctors going on strike. So first and foremost, doctors should be treated the same as other civil servants that are allowed to go on strike, okay? Another thing is that if doctors couldn't go on strike, healthcare trusts may be more likely to make doctors work more hours than they are supposed to and that they are contracted to work. Furthermore, the government may be less likely to increase their salaries, okay? Now, moving on. Some specialties don't require the patient to be urgently seen. So if the doctor goes on strike on one day, the person will just be shifted onto another day. So it'll mean that the workload for the doctor will be more intense for another day, but the person isn't going to die. However, obviously, if it's a doctor that works in A&E, or the emergency department, then there will be a much more severe outcome. Right, moving on to the arguments against. Now, first and foremost, this may reduce the public's confidence in the healthcare profession because doctors are already seen by a substantial proportion of people as well off and in the higher earning bracket. Now, if doctors say, oh, we want to go on strike and we want to get more money, that might make them seem less favourable. In 2012, there was an instance where doctors were asking for more money. This was coincidentally at the same time at which people that were less well off had to accept pay cuts. So it may reduce the public's confidence in the profession, and again, it may result in severe implications for patients' health and possibly even death.